Good afternoon, everyone. It's my pleasure to welcome you to today's all-staff town hall. For those who often tune into town halls, you'll see that, surprise, surprise, I am not Brad Ross. He is currently on vacation, enjoying some well-deserved time off, and I'm happy to be here to fill in for him. My name's Beth Waldman, and I'm Director of Strategic Communications and your moderator for today. Before beginning, I'd like to acknowledge that the land we are on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit, and we're grateful to be here on this land. I'm joining you live from the Members Lounge here at City Hall, one of the many buildings set to reopen and where some staff, including myself and many of you, will start to return in September. A quick programming note before I introduce our panel. Unfortunately, our Deputy City Manager Josie Scioli has had an unexpected death in her family and couldn't be here with us today. As a key reopening champion, Josie very much wanted to be here and share some important updates, but she is confident, as are we, that you will still get all of the same great content that we had planned. We send our best wishes to Josie and her family. With us on WebEx today are City Manager Chris Murray and the Director of Transformation leading this work, Sylvia Fraser. They'll provide us with some remarks related to our reopening plans, and then Chief People Officer Amma Kinton will join the panel to help answer any questions that you might have. A few housekeeping items before we get started. If you are teleworking today and were connected to the VPN prior to joining this meeting, please disconnect. This will give you a better overall experience. Also, if you'd like to submit a question during the meeting, look for a small Q&A icon either on the right-hand side of your screen or on the bottom of your screen. We'll leave plenty of time at the end to answer your questions, including the many questions we received in advance of the meeting. So with all of that out of the way, I'll turn things over to a man who will now, with reopening, need to resume his commute from Hamilton. And as an Argos fan, I can't say the name of that city without saying Ticats suck. Here is our city manager, Chris Murray, who is on mute.
Had to do that. So first of all, thanks very much, Beth, and you're right, much deserved vacation for Brad. And I must announce, I actually have two homes. I have one in the town which cannot be named, and the second one is actually just up the street from City Hall. So I do have residences in both communities now, so which is good. So thanks very much for everyone taking the time to be here today. If there's going to be a theme to what it is that we're going to talk about, it is slow and steady wins the race, and communication. So with that, I know last week you received some information from me that began to describe what it is that we're doing with respect to reopening. So we're going to cover some of that today. We have talked to the heads of all the programs. We have also talked to all of management staff, and now it's important that we talk to everyone in our organization and to fill you in terms of what we're doing, how we're doing it, and answer any questions that you might have. And so certainly joining us today is Sylvia, who I'm going to turn the floor over in 1 second. But before I do that, there's 3 topics I do want to cover with all of you. Those topics, as you can see on the screen in front of you, the first is, of course, employee safety. The second is serving the public. And then, of course, the last is reopening and recovery. So with that, if we can, employee safety. I hopefully, for all of you, you know us to always look after your health and safety interests. They have to be top of mind for us. They have been every step of the way since we've been in this pandemic. And so it is paramount that we address that first. What you're going to hear from us today is that this is very much going to be a gradual, coordinated, done safely exercise of reopening City Hall and the services that we provide. I want to stress something, though, I think is evident in certainly the last 16 months and are going to be evident in the weeks and months going forward, is the fact, and all of you know it, is that we're learning. Every step of the way, situations have unfolded, whether they be legislation coming from the provincial government or just the data or the facts that we've learned about the virus. But everything that has happened over the last several months, we first stop and understand it. And then based on what our understanding is, we then take action. So this is no different. You can imagine as the phase 3 or stage 3 opening, there is direction that comes from the province in the form of regulations. Our medical officer of health, together with our occupational health and safety personnel, understand that information and then they act accordingly. So, you're going to see, as I think you've seen before, when you do attend City Hall or any of our public buildings, social distancing is still going to be in place. We're going to still be expected to wear masks, and we're still going to be expected to follow all the basic rules that we have gotten used to. Notwithstanding, Canada, as you probably know by now, is the highest proportionate vaccinated population in the world. Toronto has done a phenomenal job of vaccinating its population. But nonetheless, we are going to continue to take very much what we can describe as a measured approach to reopening. And as Beth points out, September 7th is the day that we're going to start bringing people back into City Hall. And with social distancing in place, we obviously have to respect that. And so the capacity of our buildings is going to be in and around the 30% figure starting out. So that's really what I have to say about employee safety. And I know there's many, many questions that you have, and we're going to do our level best to answer everything. From a serving the public standpoint, I think it's really important. And there are those on this call that are going, really not much changed. I mean, we were asked to come in and do our job, and we did that all through the pandemic. And so from a total staff number, you'll be interested to know that 28,000 of the 38,000 people that worked for the City of Toronto worked all through the pandemic. And many of you, or at least some of you that are on this call, know that you are asked to help out in those areas that were struggling in terms of meeting the needs of our citizens. And so you were transferred over to those roles, and some of that has resulted in you coming back. But at the end of the day, many of us continued as if the pandemic wasn't affecting our day-to-day life. Of course, 10,000 of us it did affect, and so shout out to Lawrence Etta and his team, who in literally days, if not a couple of weeks, we went from about 1,000 people that were able to work from home to about 10,000. That turnaround was absolutely necessary, and it enabled many of us to continue to do our jobs from in my case, the comforts of my basement, which I am looking forward to getting out of because it gets a little tiring after a while. And so I just want to thank all the people that were reassigned and for the work that they've done. I mean, they were in our shelters, they were in our long-term care facilities, they were doing the job that was needed. And we have nothing but great respect for all of those people as well that have been working diligently in different roles. Now, in terms of opening and recovery, a couple of things I want to say. There will be, as I think was evident in some of the communication that was sent out to you last week, some counter service is going to resume actually as of August 9th. We are not moving backwards. A lot of service that we provide that we used to do in person, we are now able to do digitally. We have no intention of stopping that. I mean, people, I think, have enjoyed being able to access our services 24/7. However, there will be some counter service available and open to the public on the 9th of August, as I mentioned. We'll see how that goes. You know, if those lines are long, then we may have to add some more counter service. If those lines are short over a period of time, we may scale back. So again, as I've said earlier, everything that we do is in relation to the information that we receive. So it's a very much a measured response. And of course, after Labor Day, September 7th is when, for the first couple of months, so till the end of October, you know, we need to work with you on this notion of coming back a limited amount of time per week after October, but certainly between September and the end of October. Management and our frontline staff are going to go through a transition. We know, I mean, there's some of you, and I'm probably one of them. I haven't been in a mass transit vehicle for 16 months. And so, you know, many of us have gotten used to working from our homes. And there are circumstances in our homes that we've been able to address as a result of working from there. So the transition for the first couple of months has got to be very much what I would say is a measured, careful, respectful discussion between obviously all of you and those, of course, that are on this call that are in management. So we're going to work through that, and the details of that are going to come here in a moment. And I just want to end with, I know some of you are wondering, well, why come back at all? I mean, it's not like we didn't get work done while we were away dealing with COVID. And you know, I think there is certainly some benefit. And I know some of you certainly want to have the human interaction that you've missed. So, you know, there's always that. The other thing I want to say is that we as a city are expected to lead. We know that in our downtowns, a number of our businesses have struggled mightily. Many of those that are in the entertainment, the culinary, you know, even the travel sector have experienced significant job losses, and many of those jobs, as you well know, are not exactly the highest paying jobs. And so we know who's been affected as a result of the downturn in those segments of our economy, including retail. And so it is heavily impacted predominantly women, and it certainly has impacted other groups that have struggled economically as well. Certainly, you know, BIPOC population has struggled as a result of these employment opportunities being you know, scaled down significantly. So we as the city have an opportunity to come back, show some leadership, support those businesses, support those families, those workers that you know, want to get back on their feet and want to continue to, you know, provide for their families in the way in which they used to. So I think that's important. And I know Mayor Tory, in talking with the downtown businesses, certainly the financial districts and others that are in our office towers, you know, he can't very well make that argument if the city is not, you know, following or leading in this particular regard. So again, want to do it carefully, want to do it measured. We're learning. We're not going to be perfect, but we are going to do this together. And if anything, you know, we are hopefully, you will find us over communicating rather than under communicating. So with that, I'm going to stop there and hand the floor over to Sylvia. Sylvia.
Thank you, Chris, and hello, everyone. I'm glad to be here to provide more information on our reopening plans. And I will start with the key considerations and the timeline, starting with, of course, public health guidelines. Our reopening plans will welcome staff and visitors back into our city buildings in a responsible, coordinated, organized, and safe approach. We are aligned and adhering to provincial and public health guidelines to ensure the health and safety and to mitigate risks. Some of those considerations, of course, are occupancy limits and the 2-meter physical distancing and the mask wearing, which will still be in place. Should those change, of course, we're going to be able to pivot and change our approach, but those are the ones that are going to be in place. And with the gradual reopening, of course, with the health and safety as a top priority, our reopening will be gradual and will happen as a phased approach. So on August 9th, which is on Monday, a limited number of in-person counter services will start to open across all our civic centers. And as we move through the step 3 of the provincial reopening plan, we will gradually reopen more counter services. Starting on September 7, again, in a gradual and safe manner, office staff will begin returning to the offices under a new hybrid model that includes a combination of working some days in the office and some days working remotely. Where operationally feasible, employees will be able to return to the city work locations based on the considerations that I mentioned, such as the physical distancing and occupancy limits, and will continue to work remotely or do a combination of both. Then, from November onwards, we'll enter in a new hybrid work model that supports a more modern and a flexible way of working. And our plans will also apply to council and committees as well. What are we doing in terms of people, space, and technology? I want to touch on a couple of key points here. It starts with people, which is paramount to our planning. And it's really about that communication, very frequent. We'll continue with those updates outlining and where to go for additional questions. And as such, we have dedicated an intranet site on reopening with several employee resources. And some of those are employee handbook, first day back tip sheet, robust set of frequently asked questions, which we'll answer some here as well. Looking forward to that. And of course, the policy information as well. And if you haven't seen the Pulse survey, we have sent one out. It is still open. If you haven't had a chance to fill it and complete it, please take the time to do so. And we will continue to run these types of surveys, and because we really want to ensure that we continue to hear from you. We are also going to be holding virtual sessions for leaders and for staff, and those will be prior to the return to the office. And likewise, Team Central is ready and able to field employee questions as they've been throughout the COVID response efforts. So I encourage you to take the time to explore those resources that are available, as well as the Team Central. As far as the space preparation, and a number of those many site preparations are underway, and some of those include greeters, for example, who will support the wayfinding at all the civic centers, getting counter services ready to open. That includes the signage and plexiglass and wickets and all the measures in place for that, along with physical distancing, barrier measures according to our public health guidelines, and including managing the capacity for washrooms and elevators. Our reopening team is working with divisions as well to replace those particular assets that have been taken home. So for things like monitors, keyboards, and chairs. So staff will be able to maintain the equipment that they have at home. However, if you use a laptop, you'll need to bring that laptop back and forth with, the power cord and mouse and accessories and so forth. And along the same line of technology, there's a customer appointment booking system that's being considered to improve customer experience at some of the civic centers. I do want to spend a few minutes to talk about transportation. We are really encouraging employees to begin looking at the best commute options for them, including exploring some options like biking and walking where possible. And to support this transition for those going back to the office, the TTC, we know that TTC and Metrolinx have implemented enhanced cleaning and disinfecting protocols. At our civic centers, we do have limited commuter parking, and this was the case pre-pandemic, and is available on a first-come, first basis. And we will continue with the same parking policy that was in place pre-COVID, that is managed to our corporate real estate management division, and you can find all of that information on the intranet. We encourage you to take a look at those resources. So looking at the next slide, I do want to start by, again, people experience. People is at the center of our planning. our gradual return, allowing the transition to hybrid work, and really we want to test out what works and what does not. Through the surveys that we have done at town halls and previous to that, and we'll continue to do that, we know that we have that it's desire to have a hybrid model. That means a mix of the in-person at the office and working from home. Almost 70% of you have told us that you're looking forward to interacting with your colleagues. I look forward to that as well. There are team members that I haven't met yet in person. Very much looking forward to that. But we also heard your concerns. Over 60% are worried about being exposed to COVID, and so am I. A smaller percentage weren't sure if they'd be as productive. We understand these apprehensions, and this is why you and your leaders are being encouraged to use this period, the transition period from September to October, to really test the work arrangements that are most suitable based on your role and the operational needs. Things like, for consideration, things like staggered hours, starting early, finishing early, starting late, and so forth. At the same time, and as Chris mentioned, many staff have been working consistently through the pandemic. We have been rigorous and disciplined in our health and safety measures throughout to keep everyone safe, and we will do the same as part of our reopening plans. I want to talk a few minutes about the hybrid work. So the city is adopting hybrid work, meaning staff will have some in-office presence and some days remote work. Divisions will determine those hybrid work arrangements, and the city is not adopting fully remote work. We encourage you to use this time, the transition period from September 7th to October 31st, to really test the waters, talk to your manager, supervisor to determine what is that hybrid work arrangement that best fits that model and the operational requirements. After November 1st, hybrid work arrangements should be in place for all staff, meaning staff should have some in-office presence or on a regular basis. The hybrid approach on operational needs is key. As we know, not all jobs can be hybrid or even remote, as we know. On accountability, you have the support of the city manager, Chris, and the senior leaders to proactively begin having those conversations with your manager, supervisor on what is operationally visible on your teams. And we all play a critical role in making this transition a success. The people leaders are there to support you through this change and help you with the transition. And employees need to understand that the expectation and actively engage in the process to making this hybrid work arrangement a success. I certainly look forward to answering your questions, and I want to now pass it back to Beth. Thank you.
Thanks so much, Sylvia. I think you've given us a lot to think about and unpack, and I just want to commend you, Robbie Graywell, and your teams for your inspired leadership in planning for reopening. I'd now like to welcome Amma Akinton, our Chief People Officer, whose team has also been leading the charge through these efforts. Welcome, Amma. She's just connecting in now, and she will help answer your questions today. So as in past town halls, we'll try to get through as many of your questions as possible, both those submitted live and those in advance. So let's get started. The first question, which is also a comment and a question, you'll see me just looking at a screen, is from Ravinder Singh, and the comment is, first of all, I would like to pass on my gratitude and appreciation for the leadership team who has been working very hard for over a year to guide us in these testing times. I highly appreciate the openness, empathy, and employee inclusion shown in these tough times by leadership. My question is, are there any minimum requirements for the hybrid model regarding number of days in the office, or is it up to management to choose what works best for their teams? Sylvia, maybe you want to take that one.
Thank you for the question, Ravina, and thank you for acknowledging the efforts that have been made throughout the pandemic and going forward as well. It's a very good question, and as I mentioned, hybrid work is something that we will start with as a transition, and that transition period is very critical. We expect that those work arrangements will be worked out with the divisions, managers, supervisors, to support that those operational needs. Post November 1st, we are looking to have in-person presence in our offices. It all depends on the functions. Not all our functions are the same. Some functions are more mobile than others. So it's difficult for us to be prescriptive as to what that means exactly. We will continue to provide those guidance through our resources as far as the how-to. Again, it's really encouraging that flexibility and choice, and really take advantage of the transition period to try it out and test the waters, as I mentioned.
Thanks, Sylvia. Our next question comes from George Pentazis, and he is wondering, with cases going up, there's talk about a fourth wave. How does this impact the reopening timing? Maybe Amma or Chris, this one might be for one of you.
Start, Amma, and I'll add if I have to add anything.
Thanks, Chris. So that's a great question. Obviously, we are watching the news and paying attention like everybody is. And so, yes, it is a fact that there is concern about a fourth wave, and the case count is increasing. What we can say in response to that is that we are going to respond, and we're going to act based on the best public health guidance that's available at any point in time. Right now, we're still in reopening. We're in phase 3 and maybe wrapping up phase 3 very shortly. So based on the current recommendations, we are continuing with our planning. If at some point the public health guidelines do not support reopening, rest assured that we will revise the plans accordingly. And I will just add that one of the reasons why we are doing this transition, this gradual transition, is to allow us to scale back or scale up if we need to. And so that we've built some flexibility into the program, but rest assured that we will scale all the way back if that's what's required. But right now, the public health guidance continues to support reopening. Thanks for the question.
Thanks, Amma.
The only thing I would say, I mean, it's, Toronto, and for that matter, the province and the country has invested heavily in vaccination. We have done incredibly well compared to really the rest of the world. It's not something that is legislated, so we're not mandating, obviously, that everyone be vaccinated. But it's something that I've lived with for the past 16 months, almost daily meetings about COVID and vaccination strategy and everything else. And obviously, I think it's important that we as a society respect the need to be vaccinated. And I imagine all of us have family members and friends that are hesitant. In some cases, they can't. I mean, we understand that. And so, having some compassion and empathy certainly goes a long way, always, as human beings. But, again, there's a reason why the vaccination has been so strongly supported by the science community, the medical community, and certainly our own medical officer of health. And and I know a lot of us have done it, but it's not something that the province is willing to mandate, and so therefore we're not in a position of anyone's wondering, are we going to day one, require people to show whether or not they're vaccinated or have it. We're not there, and nor do we have any indication coming from the premier of this province that we will be there. But if it changes, you'll be probably the first to know. You might know before we do. So I think that's important to remind everyone.
And I think everyone will see that the you know, the world in which we're operating changes really quickly, and our guidance changes, and that's why, to Sylvia's point, keep checking the internet, keep reading your emails, and we'll continue to update you as policies evolve. And the next question is also about, you know, the changing world we're in. This comes anonymously. What happens if schools are closed again? Will staff be able to revert to full-time work from home arrangements if this happens? Alma?
Again, that's a great question. I have 2 school-age children myself. My children are 10 and 12. So if school closes, that will certainly have an impact on me as well as many other parents. So that is one of the factors that will certainly affect our decision making, is how we support parents. There are resources that have been created to support parents, and we will continue to update that. But certainly, if schools close, that's in some respects is a game changer for most families with children, with school-age children. So we recognize that, and we will adapt to that as well. But right now, it looks like the signals are. I just filled out my form this morning saying I'm sending my children back to in-person school. So right now, again, the indication is schools will be open. Fingers crossed for that.
And certainly the public health indicators that would require schools to close would make us look at many plans and how we deliver service around the city. So here's a question from Colin Babin. And if I'm pronouncing anyone's names, I apologize in advance. He asks, if an employee chooses not to get vaccinated, will they be required to undergo COVID testing? If so, how frequent would testing be and at whose expense? And then he goes on to ask about if you share a workspace with an unvaccinated coworker, would you be advised? And I'm wondering if Alma can help take this one.
Thank you. And Chris started up with this area on the vaccine requirement. The city is working on a vaccination policy, and that vaccination policy will provide some guidance. We are not mandating vaccines. The law does not allow us to mandate that everybody must get vaccinated, as Chris said. However, we will continue to follow the best practices that are developing around us. And as the guidelines as the guidelines evolve, we will act accordingly. I do want to say, though, that I cannot answer any question that speaks to vaccination without saying how strongly we encourage our staff to be vaccinated. It is the best line of defense that we have against this. Yes, 2 times vaccinated. It's the best defense that we have against this pandemic that has radically changed our world. And if we want to return to normalcy, vaccines are the best way for us to do that. So you will see that reflected in our communications and in our vaccination policy, a strong encouragement for staff to get vaccinated. And also, as the guidelines evolve, we will evolve with them.
Just if we can, though, Alma, just the other part of the question, though, was about testing. Are we mandatorily, are we going to require people to be tested if they're coming to work?
At this point, there is no requirement for employees to get tested if they are not vaccinated.
Thanks. And I know a lot of people, you know, we want you to be comfortable as you return to work, and a lot of thought has been going into this reopening program. You know, I'm here at City Hall with some of my colleagues in technology services and strategic communications. We're all distanced, we're masked, and it's nice to be in a room with other people, I need to tell you. So some of the positives, this is a positive thing that we're in a good enough situation to start the reopening process.
So,
But
Beth,
yeah.
can I just, sorry to interrupt. There's something I think is important for everyone that's listening here. So the work that Sylvia has been doing has not been in isolation with other governments and other private sector companies of all sizes. So Sylvia is connected right across the country, is working with the province, understanding what they're doing, as well as the major employers in Toronto. So our strategy is not unlike others. That's the first piece. The other piece, I must tell you, through the course of the pandemic, Toronto and its professional staff have, on occasion, provided advice to the province. And so it's not like we always just simply wait till we're told to do something. So, as we learn more about our reopening, how, how people are feeling about, coming back to work. I mean, again, this table that Sylvia's at, and certainly my own connections, we will communicate that, what we're hearing from people. And that has in the past, that's changed some of the direction that the province has taken in terms of COVID and dealing with the pandemic. So, I mean, we're not simply, waiting to be told. Sometimes that, if we see something and hear something that we think needs to be shared with our provincial partner in all of this, then we will do that. And Toronto's been leading on a whole bunch of different fronts. You may be aware of that, you may not. I mean, childcare was certainly one of them, and some of the work we did with our hotels we were renting for homelessness. So, we have not waited to be told everything that we've done. So, so as we hear from you, these pulse surveys, this kind of information that we're getting from you, I mean, we'll obviously, give it the serious consideration that we have to, and then if we need to communicate that to others, we will.
Thanks, Chris. I think that's really helpful context. The next question comes from Anna, and she is wondering, how will the city keep its workers safe in office spaces such as Metro Hall that are reliant on shared elevators and shared spaces with recirculated air? How will COVID outbreaks be handled? Amma, would that be, or Sylvia maybe?
I'm happy to get started.
Go ahead, Amma.
I'm happy to get started. And can I just say, because you might have heard that noise, that I have a new puppy, and she has now moved to just under me. So if you hear that whining, that is my puppy wanting to be closer to me. So I apologize. I gave her peanut butter and all the things you're supposed to do to distract her, but it did not work. So on the question, that is a great question. As you heard from Sylvia's presentation, health and safety is the top priority for all of us as we work through this. What you will see when you come back into the building is a lot of signage. It is going to, if you have not been in one of these buildings in 16 months, I think you will be surprised at how much signage there is. There are signs on each room telling you what the capacity is. There are signs on elevators that tell you what the capacity is. There are signs on the floor. There are signs on surveys. There are signs everywhere. So in addition to that, the occupational health and safety team, and I just want to give them a big shout out because they are literally crisscrossing the entire city, going to all the civic centers from floor to floor, calculating the desired occupancy and putting up signs and moving things around as necessary. So there are all of those things being done. There are policies that are in place, like our masking policy requiring people to wear masks when they're moving through our buildings, including in elevators, including in hallways and in all shared spaces. Where it's required, plexiglass is in place. So different the precautions that are appropriate for the workplace have been done. And again, to come back to something Chris said earlier, just noting that we have had a very high number of our staff working throughout the pandemic. So the team has been working on these protocols. So they're applying the same skills that they have built through that work to helping transition people back to the office. But they're still learning. We haven't done this part of it before. So we will do it, we will learn, and we will adjust as we need to. In terms of elevators in particular, there's work on the way to figure out how to manage that occupancy in elevators and to manage any lineups. One of the things that we're saying to divisions that they plan for people to return is staggered work days, so that everyone isn't arriving at 9 o'clock to go up in the elevator. So we're working through those details as the return to office team is starting to go division to division to consult about what the plans are and to provide support. So you will find a whole range of supports already in place around health and safety, but I can assure you that it has been a top priority and will continue to be throughout.
Thanks, Amma. This next question is from Adrian, and I think it's a really good one because, Sylvia, it'll be great for you to speak to sort of the difference between reopening and modern TO. So Adrian asks, it seems that the return to office plan being presented is stricter than what was discussed during town halls this past year. She had the feeling that return to office was going to be more flexible with hoteling and being able to work out of various locations in order to suit your needs. And she's wondering if you could speak to this change in message. And I think really this is the difference between reopening and modern TO, and I'm hoping you can share that.
Absolutely, it's a very good question, and so as we're preparing for the reopening, and we are introducing hybrid work and through the public health measures, and we're of course looking at that through 2-meter physical distancing, the occupancy limitations, and frankly, we kind of have no choice because we can only bring so many staff into the buildings at one time. And so we are transitioning to this hybrid work in the reopening. As far as, so that's the reopening context, is that we are faced with a limitation on the capacity. And so we are working with the divisions specifically for each floor through guidance from occupational health and safety to make sure that 2-meter physical distancing is in place. Separately, and we know we are on the journey to a modernized workplace. That is the long-term plan. And so, yes, we are in pre-implementation. We are looking to modernizing the civic centers, and we will, but we're not there yet. We haven't done the modernization yet. We're on the way to doing that. So in the interim, really is to adapt to this hybrid workplace within the key considerations that we're dealing with right now that kind of forces us to go into this model. And the difference between the two is that, yes, the Modern Teal is a program that has been approved. We're implementing it, but we haven't modernized the places yet to that vision yet. So we are going to do that. It will take years, and so we are in that pre-implementation.
Thanks, Sylvia. The next question comes from Maria. She asks, I am wondering what the deciding factor will be in determining what the ratio for work in office and work from home will be. You mentioned that we should speak to our manager about scheduling. What criteria will they be looking at when determining who gets to work from home and when we can work from home and how often? Sylvia?
Yeah, for sure, and it's really further to what I was talking before as well. So this is really, there are a number of complexities that divisions and manager supervisors in communication and conversations with the staff will have to determine. Those are functional requirements. Again, positions, functions are very different. Some of us are more flexible than others, for example. That operational capability is one aspect of it. And the second one is really that employee engagement and the collaboration. So we know, we have heard from staff, and we know there's that need to collaborate and the team building and the teamwork. And we know that's very important. And when we know that having that flexibility will be important, which is why we're making sure that with this hybrid approach, there's that transition period to allow us to test the waters and see what works and really decide based on all of those needs. So again, it's operational needs and also the need to collaborate and really allowing that flexibility and choice, within those parameters.
Thanks, Sylvia. Here's a question from Steve Brown. Has the asset retrieval process been discontinued? Can staff still collect tech assets and office chairs for remote work if they have received divisional approval? Sylvia, I think this might be another one for you.
For sure, it's a very good question, and one that it's great to make sure it's understood. So, as I mentioned, we're in the process right now to work with divisions to replace those particular assets that have been taken home during the pandemic. So, a chair, a monitor, and so forth. We do not expect that staff would return those because we are moving into a hybrid model. So those assets will continue to be required at home. We are asking divisions to no longer, allow the assets to be removed from the offices, and instead we have a process ordering new equipment where it's needed. We do want to enable that hybrid remote work continuously. There are new staff starting, of course. And we want to make sure that the tools and equipment to enable that hybrid work is in place. And so for the process for continuing to solution that is to ordering equipment, and through our handbooks and resources that we have placed on our reopening intranet site, it does provide that guidance. And we certainly have had a town hall with the managers and supervisors, their guidance specifically to leaders as well. There's a process in place to continue to order and facilitate those requirements going forward. So just in short, no, we do not want, because we're in the process of replacing assets, so we do not want chairs to keep going home because we're replacing them. So if you do require anything, please go through your division and they can order new equipment. Thank you.
Thanks, Sylvia. This next question we touched on a bit already, but maybe it's good just to re-emphasize it. It comes from Tracy Williams, who's one of our great staff members in strategic communications. She asks, pre-COVID, there were often long waits for the elevators at Metro Hall and City Hall. How will this be handled when we return to the office, particularly in light of the need to physically distance on the elevators? Are we considering staggered work starts? Chris, maybe you want to just address this at a high level.
Yeah, I mean, we are. I think it makes perfect sense that we do engage in staggered work hours, so that will certainly help address that particular problem. I mean, the obvious one, I mean, if you're on the 20th floor, this may not be something that you can do. I know I couldn't, and that is walk up the stairs. I'm on the 4th floor, so I can probably do that. So there is that option. And in terms of, you know, just the capacity, I mean, we're obviously going to continue to work with, you know, with Dr. Davila and our occupational health and safety people just to see how, you know, over time, the capacity of our elevators, the number of people that can be on them might change. So, but, you know, with everything, we're going to be cautious in the very beginning. And if evidence points us in a different direction, says that we can, you know, provide more capacity, then we will adjust. But, you know, if there's a theme to what we're talking about here, you know, that is, you know, slow and steady here is going to win this race. And so that's kind of where we're at right now.
Thanks, Chris. Zelco wants to know, there are some employees who have temporarily suspended their parking access at the office during the pandemic. If employees are required to work a number of days in the office under the new hybrid work model, can their parking access be reinstated, you know, for, call it 2 days a week and the remainder of the week under a temporary suspension? I think this is a very specific question, probably has to do with the taxable benefit of it. But Sylvia, why don't you try and address, and maybe just address commuting in general?
Yeah, for sure. And as I mentioned, we strongly encourage staff to use other options, commuting to work, biking and, you know, and walking, for example, where possible. For sure. The city does have a parking policy in place right now. The commuter parking is still available. It is limited. It's first come, first serve basis. And, you know, it is available there. So if parking has been suspended during the pandemic, I was one of them, then, you know, you're welcome to reinstate it. And certainly we are looking to make changes to the policy on a more longer term basis to address the issue about the hybrid work. But as it stands, we are in the, you know, we do have a policy. We will, Chris. Yeah.
No, well, just no. Complete your just when you're done, Sylvia. I just want.
Yeah, for now, and again, we will continue to work on different policies and addressing some of those complexities. A very good question. It's something that we are looking into it, but at the moment, we are going to continue with what we have in place. And again, you know, parking is limited. It is, you know, it's always been on a first come, first basis, and I encourage you to consider other means as well in the same time.
If I can, just want to underscore something that I know our general manager of transportation would want me to say, as well as our chief medical officer of health. Big fans of transit, as so am I, and active transportation for a couple of reasons. The capacity of our road network is limited, so the more of us that are driving into work on cars, the more we consume that capacity, which isn't always the best thing from an environmental reason. And Eileen will tell you in no uncertain terms, just from a sheer mental health perspective, you know, a little bit of walking every day or cycling or anything to keep you active is going to have a positive effect on your mental health. So those two very important people in our organization with many compelling reasons as to why driving a car, if you can avoid having to do so, those two, as well as many of us, would advise the same thing.
And can I just add as well that I think we alluded to this earlier, that we've been doing lots of work in sharing information, getting information from the TTC and Metrolinx, and we're convinced that they're doing all that they can to make the transit safe. I rode the TTC just this morning to get to a dental appointment. So I know that when I'm on there, I do feel comfortable. If you haven't been on it for a long time, I understand why you might feel apprehensive, but I encourage you over the next month and certainly during the transition period to try it out at the very least and see if you don't feel comfortable with the transit, because they've done great strides to make it safe.
Thanks. And the next question is from JL, and I think Amit's also for you. Will the current sick policy be extended so that if someone is not feeling well, they can work from home or take a sick day without feeling pressured to come in?
That's a great question. Thank you. So the city has always had generous sick benefits to permit people to allow people to work from home. So that will certainly continue. What we have done over the pandemic is we've added additional protections to facilitate people staying at home when they had to self-isolate, et cetera. So those things, we are looking at them and revising them right now as the regulations change. If you are, for instance, if you travel and need to and return, and you're vaccinated, you no longer need to self-isolate. If there's an exposure in the workplace, you don't need to self-isolate in most cases if you're vaccinated. And so as those things evolve, we're certainly looking at our policies to make sure that they fit the moment. So can I assure you that all of the same policies will continue even as the situation has changed? I can't provide that reassurance, because we're actively looking at those right now to ensure that they are appropriate to the moment, and hopefully looking at transitioning into what is more of a normal state as when it's appropriate for us to do that. But at the same time, we continue to encourage people to stay home when they are sick, and so we will continue to have policies that encourage people to do that. But we're in a transition moment right now.
And I think it's worth reminding people that there's that COVID screening tool, and likely when you are coming in and even when you're working from home, you're filling that out every day. And basically, if you have those symptoms, you're going to be told that it's not a great day for you to come in if you're feeling unwell. So just another reminder of the COVID screening tool that employees should be completing every day. This next question is anonymous, and it says, given that COVID-19 is airborne, how has the city upgraded the ventilation systems in City Hall, Metro Hall, and other city facilities to protect staff and residents? Have HEPA air filters been installed? So I'm wondering if Sylvia, you're able to talk about that a little?
Yeah, for sure. And as we're continuing to follow directions from public health on all the measures that we're putting in place, certainly the guidance on the air quality has changed as a result of COVID, and we've been following those. And some of the guidelines that we are following, they're professional certified body guidelines. For example, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, as well as BOMA, the Building Owners and Managers Association. Those are certified guidelines that really gives us that, how to operate the building systems, how do we monitor and adjust the quality. And so certainly we have and will continue to adopt if we have to, but that's, shortly after COVID has hit, and we immediately have implemented it. Our buildings are safe, and we'll continue to do that. And just a little bit on what does that mean for equality. So some of the measures include flushing the building, for example, 2 hours prior and post the occupancy to maximize the outdoor air, for example. They've also increased the fresh intake in the buildings as per the guidance and to monitor that intake in the interval. We've also developed a number of resources, again, on there's a facilities recovery playbook, and there's a number of resources that really get into more detail on some of the safety measures that we have taken into our buildings.
Thanks. And a bit of a shout out to our facility staff who have been working really hard to get the buildings ready for all of you come September and for counters starting August 9th. Believe it or not, this is our last.
Can I also add the communications team who have been excellent partners for all of us in helping us with the signage and all of those things. So it's another plug-in for you and your team, Beth.
Thank you. Believe it or not, this is our last question with the time we have. It's from Doug Bennett, who's in PFNR. He asks, WebEx meetings are here to stay. Can the reopening team provide any guidance in terms of best practices and technology required for hybrid in-person and WebEx meetings? For example, will meeting rooms be equipped with cameras, microphones, and screens to enable an effective hybrid meeting? Sylvia?
Yes, for sure. Part of our reopening plans, working with technology services, we are working on looking and making sure that the meeting rooms are equipped. There is a transition, of course, and there's a timeline to get things done. So, our priority right now is to make sure that we replace those assets, for example, but we're in the planning mode to equip the meeting rooms with to enable that hybrid virtual work, because some teams could be at work and some teams members, for example, could be at home. And so we do recognize that. It may not be in place on September 7th. I want to be very transparent because all of these efforts do take time, but we're certainly in that process to implement those, again, through technology services.
Thanks, Sylvia, and thanks all of you for the great questions today. I know we've only just scratched the surface of the many questions you have. So again, we will continue to update the FAQs on the intranet. So please visit that page frequently. And we're also going to be scheduling some staff drop-in sessions in the weeks ahead to continue to answer your questions. And I'm sure at the divisional level, a lot of your leaders will be working with you as well to answer your questions. I'd like to turn things over now to Chris for his final thoughts.
So again, just thanks to all of you for taking the time today, and of course to Sylvia and the team, a very large team that's engaged in all of this to give us the good advice that they are, and of course the communications and Amma, who typically gets all the other hard questions. So thanks to all of you. Hopefully the message that's coming across right now is that yes, of course we are learning. We've been learning ever since COVID became a global pandemic. And our actions have always been measured against the information that we're given. So we are adjusting to circumstances all the time, and this is no different. So yes, learning and adjusting. And yes, employee safety, of course, and all the questions I think people asked just now and others that have been asked that you can find on our intranet answers to. I think that's key. You have to know that whether it be the physical apparatus of our buildings or the way in which we move within our buildings, all of that has to be done in a manner that keeps you safe. And yes, communication. I mean, you're going to get more communication than probably you want, but I'd rather be faulted for that. And when we say communication, it's two-way communication, meaning simply, you have questions, we need to provide answers, and we have new information we got to share with you when we get it. So this is a journey that we are going to do together. So yes, counters are opening up August 9th, as pointed out, and the beginning of us, returning to work, although differently, of course, now with COVID, is going to start September 7th. And so that first 2 months is really about our frontline workers and our management working together to figure out, what is the best course moving forward. And then, of course, in November is when, things should be clear in our minds as to what is our hybrid working relationship going to be like. And I'll just end by saying, vaccinations have been top of mind for all of us for quite some time now. And I know many of you have gone and been vaccinated and hopefully double vaccinated. We can't stress enough the importance of that. And just thank you for taking the time to be with us today, and just stay tuned. And we'll get through this together as we have for the last 16 months. Toronto Public Service is a phenomenal group of people that do incredible work. So we're going to continue doing that. And again, thank you for your time.
Thanks, Chris, and thanks to and Sylvia for being part of our panel today. And a big thanks to all of you, our dedicated and committed staff who have day in and day out continued to provide quality work throughout the pandemic and really served the residents of Toronto well. I want to thank you in advance for all of your support in making this transition back to our offices a success. Quick reminder that a captioned version of this town hall will be made available on the intranet and on the Ellie employee portal in the next few days. And I look forward to seeing so many of you back in city work locations soon. Have yourselves a great day. Goodbye.